Yes, that's all. How? Can you hear me or not? Can you see me? Do you see me? You see me? Can you hear me? Someone, please write something. Anywhere. Can you hear me? I can see and hear you clearly. All right, then let's begin. We won't wait for everyone, right? Whoever needed to come has already arrived. Let's go. Let's start with the questions and answers. Let's start with the first ones. All right. All right. First question. Is it possible to cure scoliosis at the age of 30? Yes, it is possible. It all depends on how flexible the spine itself is and how mobile the joints of the spine are. It depends on whether there is any deformation of the vertebrae or deformation of the ribs. If there is, then it won't be possible to fully cure it. But in any case, no matter how old you are, you need to work on it. You need to treat it to stop it. The process of degenerative changes in the spine, because with scoliosis, there is a chance that they will develop faster because the load can be uneven, and that's why the joints can wear out faster. But it also happens that the scoliosis is quite severe. The degree of scoliosis is quite high. But at the same time, at the same time, the person doesn't feel any discomfort. Nothing really hurts even. That happens too. So it can be treated and it can also be cured. Even, well, you could say first degree scoliosis can be cured even at 30 years old if there's no deformation. If there are no wedge-shaped deformations in the vertebrae, right? The second degree as well. Well, it depends on the angle, how severe the curvature is. Well, the third one, of course, can be completely cured. Not even at 30. You can reduce the angle. Okay, next. When will the video with the exercise for right-sided scoliosis be released? Well, I think I'll make that the next one. Could you please tell me if it's possible to do Nordic walking after a hip replacement? How many kilometers are optimal? Well, if you don't like it, you can decide the distance yourself based on how you feel. How do you like it? How? The main thing is that nothing hurts when you walk. If you like walking or doing Nordic walking, go ahead and do it. That's it. There aren't really any restrictions. No. If you feel no pain, go for it. As for the optimal number of kilometers, that's up to you. If you've been walking your whole life, if you've always walked, you can do 10 kilometers and not even feel it. But if you've mostly just walked from the couch to the bathroom, then even a few kilometers will wear you out. Well, that's just a matter of life experience and training. Are you planning to leave Russia because of recent events? Most of your patients were from abroad, after all. No, I'm not planning to. Yes, I will go. No, I'm not going anywhere. I'll go together with you. Right. We forgot the topic about eyesight. How can you improve poor vision at dusk? Yes, there were several videos about eyesight. Right. If you're interested, we can continue this topic. Yes, we can also talk more about decreased vision at dusk. Yes, there are exercises that can actually help restore visual acuity. When it happens that the sun is shining brightly or the lighting is very good, some people have almost perfect vision, like 20/20. But as it gets a little darker, when twilight comes, then everything starts looking blurry to them. And then when it gets even darker, they start to see everything more clearly. There are ways to fix this. I know this because it happened to me again. There was a time when I read a lot of books while I was in school, and my eyesight got worse. It didn't last very long during my first year at university. When they checked our eyesight, it turned out to be -1, -1.5, or something like that. But then I fixed it. Well, I already made videos about how I fixed it and what I did. Yeah. Well, I also showed the exercises, and you can also make a video on this topic, specifically about how to improve your vision in such twilight conditions, so that your low light vision is good. That's right. Today, my lower back had restricted movement. My movements became limited. How do I fix this properly? Today, my lower back had restricted movement. Fixing it properly. Well, this often happens because of muscle spasms. This can also happen because of inflammation in the muscles. This can happen when the muscle is overloaded. And this can also happen when joint restriction develops along with the spasm. That's it. There can be many options here. Maybe it's the psoas muscle that cramped. Maybe it's the quadratus lumborum muscle that happens often. It could even be the gluteus medius muscle. And sometimes it happens that it cramps and the pain radiates. It seems like your lower back hurts, but actually it's the gluteus medius muscle that's tense. This kind of referred pain can happen. You need to check it. It's hard to say. So if it just happened and there's nowhere to go at all, you can try applying some kind of anti-inflammatory medication. You can try it, but don't use too much force, right? At least it helps prevent the swelling from worsening. If inflammation joins in, it'll get worse, because it often happens that when there's a muscle spasm, inflammation and swelling also occur, and then it all drags on. That's right. Next. There are many different activities and workouts, but warm-up exercises like rotating your head up, down, to the sides come up often. That's straightforward, but full head rotations seem unnatural. Coaches disagree. What's your view? It all depends on how fragile your neck is and how well your muscles are developed. Some people can afford to rotate their neck, while others turn it just once and that's it. Their head immediately locks up. So you can do this exercise as a warm-up if your neck muscles are in good condition and your mobility is good. But if you have any problems with your neck, if you make these movements like turning or tilting your head and you hear something rustling or creaking, then instead of rotations, it's better for you to do movements like simply up, down, to the side, right, left, and tilting. These kinds of turns, but not through the full range of motion. You also need to be careful with turns. If you can already do all these movements freely, then you can start turning as well. All right, next. The topic of vision is relevant. Well, we can talk about vision too, yes. How can you stop the progression of osteoporosis, if that's even possible? And if not, then any of your recommendations for maintaining physical fitness for a weakened musculoskeletal system with a set of gentle exercises to strengthen the ligament. That's right, I've fixed my walking biomechanics and monitor it constantly. Well, sometimes it may seem that they've restored their walking biomechanics. A person thinks they've restored their walking biomechanics. That's how it seems to them. But sometimes in reality, they haven't really restored it much at all. That's it. Well, with osteoporosis, of course, it's a systemic disease. Here it's related to hormones, nutrition, and physical activity. If we talk about physical activity, for example, if your legs aren't bearing any weight, if most of the time is spent sitting, lying down, then of course the bones become more fragile and the muscles become weaker. It's even worse if you have such a stop and start routine, a stop start lifestyle. For example, you lie down or sit most of the day and then work out, let's say, right? So you work out actively and then the next day you're passive again, you behave that way. So in that case, it's not very good. So if you exercise, it's better to be active so that you have movement throughout the day. Push. If you spend the whole day sitting, then at least once an hour or every 45 minutes, get up, not just to go to the bathroom or eat, but also to move around a bit, walk a little. How should you sneeze properly when you have a cold? If you have a large hernia, don't laugh, but the pain is very severe. I sneezed so much that I can't lie on my back or on my stomach, only on my side. That's because when we cough or sneeze, the intra-abdominal pressure increases. And so when there is an inflammatory process, when there is inflammation, this sudden contraction of the abdominal muscles, the abs, it also affects, well, it kind of irritates this nerve root. That's it, that's it. If you like sneeze often, if you have allergies, for example, yeah, to something, this can really cause a big problem. What should you do in this case? Try it first. First, experiment with coughing. Like, try it out, cough and see if pain appears or not. Next, try it sitting and standing. See if there's a difference or not. For example, try leaning to one side and coughing, then to the other side and coughing. Lean forward a bit and cough, and also try turning. So find a position where you can cough, since you can't sneeze on purpose, right? But you can cough. And find a position where you feel the least discomfort while coughing, or maybe you won't feel any discomfort at all. Most likely, you'll also sneeze in this position. So find this position and then use it when you need to sneeze. All right, moving on. There are a lot of questions. Next. So, all right, more. A lateral adaptive scoliosis is a case of the most common imbalance in the pelvic area. A specific example, the left side of the pelvis is behind the right. The left leg is longer and the posterior tibialis muscle on the right leg is weak. Thank you. Very often, a person may feel that their pelvis is in a certain position, but in fact, what they feel may not be true. And the left side of the pelvis, it can turn like this, it twists, it rarely turns like this, and it doesn't turn like this. It usually twists here. You can get confused about which part of the pelvis it is. Sometimes the upper part of the pelvis is in the back and the lower part is in the front. For example, you might feel like one leg is longer and the other is shorter. You need to check this as well. Well, it's also unclear how you determine that the posterior tibialis muscle is weak. That's it. Well, let's assume that's the case. So let's say that the left side of the pelvis is behind the right. The left leg is longer and the posterior tibialis muscle on the right side is weak. That's it. Well, what should you do in this case, right? So the left leg is longer. Sometimes there is an anatomical shortening of the leg, and sometimes there is a false functional one as well. It all depends. If there really is an anatomical shortening of the leg, it's very rare. Usually when there was a fracture in childhood, for example, and one leg became longer and the other shorter, or osteoarthritis where the joint space is smaller on one side than the other. If there was a meniscus injury, the leg will be shorter. So in this case, you need an insole. Often a heel lift is recommended, but if you use a heel lift, it will feel like you're always standing on your toes. If one of your legs is shorter than the other, you need a special insole. Well, if not, at least a heel lift, yes. But that's rare, very rare. Usually a difference of more than 2.5 centimeters doesn't require such correction. The normal difference can be up to 1.5, maybe 2 centimeters. All shoes can even be adjusted. They just get pressed down more on one side. More on one side, less on the other. The sole adjusts itself. There you go. But let's say, for example, if it's anatomical, there's nothing you can do about it. If your legs are different lengths, at least you need to even them out like this, yes. And if it's a functional difference, how do you check if it's really functional or not? So you look and it seems to you that one is longer and the other is shorter. Stand up and try to straighten both legs. One leg will be easy for you to straighten and the other will be uncomfortable to straighten. The one that straightens easily is probably the shorter one, and the one that's harder to straighten is probably a bit longer. It's hard to say for sure just like that, but let's see how you can check. Here, try going up onto the toes of one foot like that. Put one foot forward, the other back, and go up onto the toes on that side. On one side, you may be able to rise up easily. The pelvis on that side will rise and the foot will go up on the toes. But on the other side, it's harder. It will go up with difficulty. And this is also related to the fact that the quadratus lumborum muscle on this side is weak. Well, in short, the pelvis won't lift. That's it. Well, where to start? Start, relax your oblique abdominal muscles. Well, I mean, work on both sides, both right and left, so you don't have to guess which one is shorter or weaker. Just start massaging both the right and left sides. Try a simple one about the length, and the one that's shorter will just stand out. It will be under tension there, and you'll feel it more. You can start with this. So someone is complaining that it's a bit late. It's a work day, but that's okay. You can watch the recording later. It's really interesting. The topic is about reducing lymphatic swelling from the feet, ankles, and ankles, which is noted since childhood with longitudinal and transverse flat, as well as after several old sports injuries to the feet and ankles. I hope I didn't scare you with the description, but in general, lymphatic swelling doesn't get much attention, even though lymph stagnation is actually very important. It plays a significant role not only in muscle function, but in general it affects many things. Pain is often caused not only by muscle spasms, but also by swelling, which makes it even worse. A muscle is actually inside the fascial sheath, like a little pouch. And if the muscle inside this fascial sheath starts to swell, if there's poor lymph circulation, fluid begins to accumulate in the muscle. So it tends to increase, and because of the stagnation, this kind of swelling occurs, and that's what causes the poofiness. In addition to compressing the lymphatic and venous vessels even more, it also starts to compress the nerves themselves, which are located both in the fascia and within the muscle tissue. So sometimes the muscle is weak, it's tone. is poor, but it's still so strong. Swelling like this is very common in women's trapezius muscles, as if they have huge, powerful trapezius muscles. Actually, it's just swelling that makes muscles appear larger, and once the swelling is gone, so is the size. It literally deflates, shrinks, and fades away. The trapezius weakens, making it look huge and overdeveloped, but it's just swelling. The appearance is caused by swelling. The pectoralis minor, the scalene muscles play a big role in lymph circulation and to improve lymphatic and venous outflow from the legs. The lumbar muscles are very important. So next, when you make a video about fixing tinnitus, you promise but haven't done it yet, please make the video if possible. Also, another question, is there a way to fix or correct a big shaped nose? Please continue making your latest videos. Pasha, thank you. This slip through will do. The tinnitus video will do that too, no problem. Is it possible to fix the protruding bone? The fifth vertebra, I think. How much time would it take if you exercise regularly for it to go back into place, and which muscles should be trained? Thank you. But this should be kept in mind for the neck, right? Up to the neck. The thing that often happens right here. But if it's just a bone sticking out, yes, it shouldn't cause any discomfort. If you don't like it, you can build up the muscles there, so the muscles cover it more. But sometimes what you call a hump at the base of the neck there, of course, you need to balance the shoulder blade, reduce the tension in the chest muscles, and work on the back muscles, strengthen the extensors and the scalene muscles. Basically, work on those areas. It's not about what you can drink to feel better, Kostiasto, just to feel good. Subtitle editor A. Semkin. To be continued. Well, first of all, you need to stop drinking alcoholic drinks, and things will immediately get better. Please answer, can a disruption in the tone of pelvic muscles lead to the development of varicose veins in the legs? So the pelvic muscles, if you mean all the pelvic muscles, yes. That includes the gluteal muscles, yes, but indirectly it can, but the gluteal muscles, the tone of the gluteal muscles are less important. The lumbar muscles play a bigger role. Sometimes a spasm in it can cause compression of the veins and disrupt venous outflow, and spasms often happen as well. But when weakness develops in the soleus muscle, weakness of the calf muscle. The calf muscle becomes weak, the soleus muscle spasms, and this happens. So blood can't flow through the deep veins, and it starts to flow through the superficial veins. They swell up, disrupting the valve system and affecting its function. As a child, I jumped off a garage onto ice, landing on straight legs, and bruised both of my heels. I walked on my toes for half a year and spent several years recovering. When I jumped off a stool, the pain would come back. And why did you jump off the stool? Why would you do that? I jumped off the garage, then I jumped off the stool. Ever since then, bones have been sticking out of my heels, and my shoes always wear out around the heels. As a kid getting x-rays, I told the doctor my bones were sticking out. He said it only seemed that way because I was scared and everything was normal. I don't have any complaints now, although later on I did develop scoliosis and all the related issues. I'm from the third row in school, doing the ball exercises for the feet and the whole body from your videos, and it really helps. What else would you recommend? Well, your heels aren't bothering you now. I recommend not jumping off garages or stools onto straight legs. No complaints mean you're doing everything right, and keep it up. Everything you're doing is fine. Just don't jump anymore. That's right. In October, my shoulder joint started hurting. It dragged on until December. During the appointment, even with the doctor, we couldn't figure out if it was an injury or not. He diagnosed suspected osteoarthritis. The x-ray didn't show anything unusual. The joint was severely inflamed. could only move my arm about 15 centimeters to the side and forward just by eye. In January and February, I took a course of my vitamin injection. In February, I went to an appointment, but the doctor was sick. Now the inflammation is gone. I can now lift my arm 30, 40 centimeters to the side. I can lift it 50, 60 centimeters forward from chest to shoulder, but there's still some discomfort. Can I restore joint mobility myself? Maybe with exercise. Can I manage without physiotherapy for now? Thanks. Well, it's not possible to manage without it. Has it been like this since January or since when exactly? It's been hurting since October. But probably if it's been hurting since October and you've tried to handle it on your own and nothing is working, I think it's time to see a doctor. That's it. You shouldn't wait any longer while it's still moving fully before it stops completely. That's all. Show it to a doctor and let them prescribe you something. Good evening. Can you suggest an effective exercise for the trapezius muscles, especially the lower part? Thank you. Yes, there are such exercises. The trapezius muscle is actually a muscle that often lags behind. And the fact that it hurts, it's painful. When people touch the trapezius, they touch it. Yes, it's painful. Very often, it's still painful when it's weak. When the trapezius gets weaker, it tends to become painful because it takes on a lot of load. It holds the shoulder blade, it's involved in movement, and people try to relax it. But very often, it doesn't need to be relaxed, it needs to be trained. That's it. Well, I need to show this. I'll make a video then. How to train your trapezius muscles. There was a course, by the way, now it's probably no longer available on YouTube. All exercises were included, even walking. And there was an exercise for every muscle. I mean, everything was broken down in detail, including the trapezius, the middle, upper, lower, all parts of the trapezius, whichever you want. That's it. That's it. But now it's impossible to get it on YouTube anymore, though you could before. And well, I don't know what to do. Maybe I could make it separately somehow if you want. I could make all the exercises separately, put them together, or even divide them into different parts, like walking, different muscle groups, the foot, all of that was there too. Those exercises that, how should I put it? They're not the ones usually recommended. Have you tried magnesium oil and gauche scraping massage around the heel bone? Well, that's recommended for those who jump on the trampoline. Good evening. Can you explain how bite correction affects the spine? My son has scoliosis and wears braces. Since then, he often has headaches and the scoliosis hasn't really improved as the doctor promised. I'm worried that I might have harmed him and I'm wondering what can be done in this situation. I wanted to bring him, but it started early. I want to express my gratitude to you after the treatment with you. I felt like I came back to life. I'm very glad I turned to you. I'm truly grateful. You're welcome. So the question is, right? How does bite correction affect the spine? It doesn't really affect it much. It has more of an effect if, for example, there were headaches. And then it can have a positive effect. But here it's not the bite itself. How should I put it? It's not the bite itself. Sometimes the jaw just moves asymmetrically. When there's a muscle spasm in the pterygoid muscles here, they get tense and the jaw starts moving asymmetrically. That's what has an effect. That's it. And the jaw itself during physical exertion, especially during physical exertion, sometimes the teeth clench. And when this clenching is not symmetrical, the balance is disturbed because of it. So it affects balance more. Yes, that's true. So there is an influence, but scoliosis does not develop because of the bite. It's all the same. So those who make insoles say that everything comes from the foot. Now you'll put in an insole, put on your shoes, and everything will go away. Those who treat teeth, orthodontists, they say you need braces. Everything comes from your jaw. It's just like those atlas specialists who always treated the first vertebra first. See, it's similar. They're looking for one cause, but they just can't find it. So did I answer? Thank you. No, nothing bad happened because of that. But the bite was corrected. That's good. It was wrong before. Now it's right. That's not bad either. But very often the neck is also connected to the bite. That is, for example, sometimes it happens like this. For example, the head is tilted a bit like this. On one side, the muscles are short. On the other side, they're long, and the jaw opens like this, like this. So you need to keep your head a bit more centered so that the movement of the jaw matches the position of the head, like this. It's already been half an hour. I've been answering for half an hour now. Just a little more now. All right. I won't answer everything now. There will be more chances. This isn't the last time. I'll answer later. Let's do a few more. Let me see how many questions there are in total. Oh no. Oh no. Okay. This will be the last one for today. Write more tomorrow. I'll answer more tomorrow. I'll take this last one and find an interesting final question to answer. That's enough for now. It's late and people are complaining. Thank you. Hello, doctor. I'm 38 and have 1 thoracic disc protrusion and 3 cervical disc protrusion. I feel no pain, but when I lie down and take a deep breath, something cracks in those areas, possibly the vertebrae or ribs. Then I experience severe weakness. It's even hard to stand. There is pressure between my shoulder blade, and sometimes I get a headache. Also, the muscle at the back of my neck gets tired very quickly after standing on my feet for just 1 hour. Since November 2021, that is for 4 months now, I have been doing the neck exercise you showed in your videos. I go to the gym and do strength training. Could you please tell me how to get rid of the cracking in my spine and how to make my neck stop getting tired? In addition to exercises for the long neck extensor, very often you also need to train the sternocleidomastoid muscles and the entire side surface of the neck. The scalene muscles are also sometimes needed in training. There are certain exercises and movements, and I believe there's already a video on the channel about this. Take a look at these exercises and start doing them. Cracking sounds also happen often. Instability develops, the muscle becomes weak. Everything starts to wobble there. Sometimes the muscle on one side is short and loses its elasticity, and that's it. Well, when there's no movement, meaning your joint hasn't moved for a long time, you move it maybe once every 2 hours. It will move with a crunch, of course, because the joint fluid hasn't been produced for a long time. To prevent cracking, keep moving. Everyone's joints crack if they stay in one position too long. That is, the crunch in a joint that hasn't moved for a while. If it crunches once and then doesn't crunch anymore, there's nothing to worry about. But it means you need to move more. But if it crunches every time you move, that's not good. That's already close to the articular surface. At that point, you need to work on all the muscles and see which one is tight and which one is weak around the joint. The weak one around the joint. Continuation of the new one. So now one more question, something interesting. An interesting question. Something really special. Let's take this one. Good evening. When driving, the driver's right leg is constantly under tension. Can this affect the lumbar spine, cause pelvic tilt, strain of the quadratus lumborum muscles, and reduce or shorten the range of motion of the iliopsoas muscle? Can it have an impact? Here, when you press the pedal, your foot is in this position, and these muscles that lift your foot upward are constantly tensed. And if you often have to drive, if you drive more than you walk, over time, these muscles become excessively tense and they don't let your foot move freely in this direction afterward. And you need to relax these muscles, massage them. You can stretch them. But with the opposite muscle, on the other side, what? To achieve symmetry, you actually need to train these muscles instead. And because this movement becomes better developed on the right side, And on the opposite side, the push off with the foot is kind of disrupted. This affects the movement, making it asymmetrical during the step. And this extension of the foot also affects the fact that there may be an excessive forward swing of the leg. Sometimes when stepping with the right leg, the leg moves slightly to the side instead of straight forward because of this. Right. That can happen, yes. So through walking, because the way you walk changes due to this tension, it can also affect the tension in the quadratus muscles. All right, that's it. Let's finish this stream for today. If I press the right button, I'll save it and then add it here to the group. For those who went to bed early, you can watch it. And for those who didn't go to bed and just watched it, you can watch it again. Oh, it's not forbidden. You can do that. There you go. I remembered the questions I didn't answer. And tomorrow we'll meet again tomorrow. And send any other new questions as well. We'll answer them. We'll discuss them. Yes. All right then. Okay, that's it. See you next time. So need to stop the recording first. That's all.